Morning friends, welcome back to my YouTube channel and don't forget to subscribe my channel Medical Classes by Dr. Srimati Kumar Acharya, and also please give your valuable comments. So as we know, we were discussing about history taking, and in the last part we have completed the main complaint, how to write the main complaint. Now we come today we will discuss the most important part in the history taking, that is history of present illness. So present illness, a patient is having some illness now, and what is the history of that particular illness, that has to be now evaluated. Now what is present illness? In the present history, we will go for thorough analysis of the main complaints. That's all. What are all the main complaints that you have written, that has to be thoroughly analyzed in the present complaints. We should not go here and there. So we know that what are the main complaints. Now take the main complaints one by one and analyze them. And that itself is a history of present illness. The complaints which are mentioned in the main complaint should be thoroughly analyzed in the present history. Okay. So now, as a rule, before starting the present history, you have to ask one simple question to the patient. What is that? Since how many days back the child was apparently or absolutely normal? Or if you are taking the adult history, since how many days back you are absolutely or apparently normal? We know that. We don't know that whether they are really absolutely normal or apparently normal. We assume that apparently normal. Okay. So this particular question helps to understand the total duration of the disease. See, when you ask this question, in the main complaint, patient has given, I have got the fever. Patient complains of fever since last 10 days. Okay. Now you are going to analyze the fever, which has been started 10 days back. But still, when you go to the analysis, you ask a simple question. Since how many days back actually you are absolutely or apparently normal? Then patient says sometime, doctor, since last 1 month I have got some problem, and since last 10 days I have started with the fever. Okay, so now you have got a history that patient is actually suffering from since last 1 month, and as a continuation of the same, since last 10 days the fever started. The illness was started somewhere around 1 month. So asking this question is quite useful to understand the total duration of the illness. Otherwise, patient comes to you and tell when actually problem started. Okay, actually the symptoms are started. He started suffering more. So then only he visit to you. But that problem would have been started little earlier, maybe 15 days earlier. So therefore, asking this question is quite beneficial, quite useful to understand the exact duration of the illness. So always ask one simple question, that is, since how many days back the child or patient is absolutely normal or apparently normal. So we cannot say it is absolutely, because we have to believe what the patient says. Therefore, we assume that apparently he is normal. Or sometimes patient may say, yes, sir, 10 days before I am absolutely normal, there is no problem at all for me. Last 10 days itself I have started with the problem. Now the things are clear. Before 10 days he had no any problem. So this simple question helps a lot in the medical history. Okay. Again, we know that when you take the present history also, present history should be taken always in a chronological order. It should be always taken in a chronological, just like main complaint that we have taken in the chronological order. While we are doing the analysis also, the symptom which has been started first, the first started symptom should be analyzed first. Second started symptom should be analyzed second. Okay. So present history should be taken again in the chronological order when there is more than one symptom. So no unwanted history should be documented. Now what actually happens is, if you are not well versed in history taking, our history taking, present history contains so many unwanted information. The patient was absolutely normal since last 10 days back. Then he was suffering, started with the fever, and the fever was not reducing. And then he visited a doctor. And the doctor has given 4 types of medicine. That medicine contained one green color, one red color tablet. He has taken that medicine. It is not started. Then he visited another hospital. There also he was admitted. So it contains so many unwanted information. All this information can be written in one single word. What is that? Patient was taking medicine for the same but not relieved. That's all. If you want more details of the treatment, we will have treatment history. Okay. So anyway, so unwanted history should not be documented. Okay, and hence we have to follow the fixed format to analyze the main complaint. Now, to avoid the unwanted information and to get only the pinpoint information of the present complaint, so what we have to do? If you follow a simple format, okay, asking the question, format of asking the questions, you never miss any important information related to the disease. But if you haphazardly take the history, then you will have the problem. Okay, so therefore now we will discuss about this important format or the 10 points which are used for the analysis of the present illness, or for the analysis of the main complaint to take the present history. So we have to use these 10 important points. What is that? Okay, so these points are: number one is onset of the disease. Just this is very important, just remember it. Onset of the disease, progression of the disease, okay, then comes severity of the disease, then comes character of the disease or symptom, character of the symptom, then character, or it is also called as nature, okay, character or nature of the symptom. Next comes aggravating and relieving factors, then course of the illness, then comes diurnal variation, then comes effect of the food, and then comes associated symptoms. So if you ask these questions for each and every symptoms, then you get the pinpoint needed information for your complaint, and your history will not be misguided, and you are actually taking the information what exactly is required. Otherwise, you keep on taking some unwanted histories and filling the case sheet with some unwanted history which is not at all required. We want to get the information of the present illness, present symptom. So question should be directed for that. Okay, where he is going, what he is taking. These informations are not required for us. We require a medical history, isn't it? So we require the information of that particular main complaint, for which you have to follow these 10 points: onset of the disease, progression of the disease, severity of the disease, nature or character of the disease or symptom. It may be, it's not disease, it is symptom. Nature of the symptom, nature, progression, severity, then comes nature or character, then comes aggravating and relieving factors, then comes course, then comes the diurnal variation, then comes effect of the foot, and then comes the associated complaints. Last one is any other extra information. Okay, so like this 10 points has to be taken in each and every complaint to have a complete present history. If there are 3 symptoms, first started symptom should be analyzed in this way, then comes to the second complaint, then come to the third complaint. Okay, suppose the patient is having fever since last 10 days, patient is having abdominal pain since last 5 days, and vomiting since last 1 day. Now first take the fever. Patient was apparently normal 10 days back. Then he started with the fever. And look at the onset of the fever. Look at the progression of the fever. Look at the character of the fever. Look at the severity of the fever. Look at the aggravating and relieving factors of the fever. Take the history of diurnal variation related to the fever, role of or effect of the food on the fever, associated symptoms with the fever, any other extra information. Okay, fever. Once this fever history is completed, then go for the present history of a second started symptom, that is abdominal pain. Along with the fever since last 10 days, patient also started with the abdominal pain since last 5 days. onset of the abdominal pain is dash, progression of the abdominal pain is dash, relieving factors are these, aggravating factors are these, nature of the abdominal pain is colicky or whatever, then diurnal variation is like this, evening, morning, etc., and then associated symptoms. So after completion of this, along with the above symptoms of abdominal pain and fever and abdominal pain, patient also started with vomiting since last 1 day. Again, vomiting has contained this particular onset, again the gradual or gradually progressive or stable and aggravated by this, relieved by this, nature of the vomitus is this, okay, and diurnal variation is this. So like this you have to take the history in a clear cut way, one by one, in a chronological order. So this is the history of a present illness. Okay, so now we will have one by one evaluation of this particular different points. First is onset of the fever. So for example, I am taking fever, vomiting, and fever, abdominal pain and vomiting. Okay, this is a standard complaints we are taking for the understanding purpose. Okay, so patient has got, suppose, fever. Now what you will going to ask? 10 points. Don't forget these 10 points. Number one is onset, isn't it? So onset means how the fever started, whether the fever started gradually, whether the fever started suddenly, whether the fever started acutely, or whether the fever started insidiously. So now onset may be sudden, onset may be very sudden or rapid. Sometimes we say rapid. Okay, onset may be rapid, onset may be acute, onset may be chronic, or onset may be insidious. Okay, insidious. Now for example, most of the viral fevers, they are having acute onset, isn't it? Okay, viral fevers are having acute onset. Diarrhea, sometimes the osmotic diarrhea, etc., so they are having acute onset. Okay, here the onset is very acute, because in the present history you can use all the medical terms. There is no restriction. Only in the main complaint you should not use any of the medical terms. In the present history you can use all the medical terms. Okay, so if it is acute onset, for example, diarrhea is acute onset, osmotic diarrheas. Okay, then bacterial viral fevers are of acute onset. Suppose a patient is suffering from cough and suddenly started because of foreign body aspiration. Here the onset is sudden. Of course, sudden and acute almost all same, but rapid. Onset is very rapid. That is in case of foreign body aspiration. So onset differs here. Okay, so acute, there may be some chronic onset. For example, usually the bacterial infections are not very acute. Okay, so chronic, like congenital hemolytic anemias, so they are having chronic onset. Okay, celiac disease, they are chronic onset. In the tuberculosis also chronic onset, Crohn's disease, chronic onset. So one is onset. Look at whether it is acute onset, whether it's a chronic onset, whether it is insidious onset. Insidious is in between. Insidious means in between the acute and chronic, like typhoid fever. Typhoid fever is the best example of insidious onset. Okay, and sudden onset may be sudden in some of the vascular conditions. Paralysis, we know that because of the thrombosis, embolism, rupture of the vessels. Okay, we know that it is a sudden onset always. So there are only 6 matters. We have already discussed the 6 factors which are having sudden onset. If the cause is vascular cause, if the cause is mechanical cause, if the cause is allergic, and if the cause is metabolic, if the cause is toxic, traumatic, and drug reaction. So they are all of sudden onset or rapid onset. Okay, rapid, sudden and rapid. Rapid means extra sudden, you can say very sudden. Okay, allergic, immunologic, electrolyte imbalance. So they are having the rapid onset. Okay, so instant, very instant, foreign body aspiration, choking, etc. Okay, or sometimes syncope and all. So this is how onset. Okay, so for each and complaint, first onset you have to decide. Ask the patient how it is started. Started acutely, started chronically, or started rapidly, suddenly, or insidiously. That's all you have to take. Once you take this particular point, then again this point will going to guide you to the diagnosis. Because if it is acute onset, likely to be, simply I am telling, likely to be a viral fever. If it is of sudden onset, okay, so suppose fever, we are not discussing about fever, some other cough, sudden onset, like it may not be a viral, it may be a bacterial, or it may not be a other point, but most probably it is some aspirations. So like this, each and every point will going to guide regarding the diagnosis of the disease. So following this format is very important. So first we have seen that is onset of the disease. Now look at the progression of the disease. What about the progression of the disease? Okay, the symptom which is started, it may be gradually increasing, it may be gradually decreasing. Suppose the progression after beginning of that particular problem, how it is progressing. Okay, that progression may be increasing, progression may be decreasing, or progression may be stable, isn't it? Suppose fever is started, the fever is gradually increasing, fever is gradually decreasing, or fever is stable. Now, gradually increasing means it is a bacterial fever, gradually decreasing means it is viral fever, it is stable means it may be some immunological fever. Okay, so progression may be gradually increasing, gradually decreasing, suddenly increasing, and suddenly decreasing. This is also possible. Okay, or stable. Stable is also called as non-progressive. Stable. Or the progression may be waxing and waning type. Waxing and waning type. Sometimes it is increasing, sometimes it is decreasing. As happens, most common example is waxing and waning type of jaundice, which happens because of carcinoma of the head of the pancreas. Okay. Another is waxing and waning type of edema, which occurs in case of nephrotic syndrome. Okay. So it may be waxing and waning type. Okay. Or it may be suddenly appearing and it may be suddenly disappearing, as in case of allergies. One of the most common thing in allergies is appears suddenly, it disappears suddenly, again reappears suddenly. Or sometimes progression is regression type. That means, for example, milestones are delayed, and after one particular point, a delayed milestone, they start regression. So this is how the progression is going on. Okay, so progression may be gradually increasing, gradually decreasing, suddenly increasing, suddenly decreasing, stable or non-progressive, waxing and waning type, or sudden appearance, sudden disappearance, sudden reappearance. Okay, or regression type. Okay, regression type. So this is about progression that we have to understand. The first point, suppose fever, patient says that fever is of acute onset. Fever is of acute onset and it is gradually progressive. Fever is of acute onset and fever is gradually progressive. So we will continue the same in the next class. Thank you very much.